On all three of those that you highlighted there.
There's a lot of activity, and you'll see anytime you get into a hospitalization, you get a lot of different miscellaneous charges that come through that create a lot of claims. Look at the outpatient hospital miscellaneous, and then look at the next one down, which is outpatient surgery. So, part of it's not a lot of surgeries really, if you think about it, but there's a lot of miscellaneous stuff that goes with that surgery. You got the outpatient surgery center charges, you've got, you may have...
physical therapy probably ends up in there, and a lot of different...
Yeah, and a lot of supplies, and there's just a lot of things that fall into that category. So you're basically, if you looked at it, you'd say, well, for every outpatient surgery, you had roughly another 6 miscellaneous charges. 6 that would fall into that category. Now, as you study this report, let me just tell you something about this, because you may start to do some math and wonder, these numbers don't seem to add up, so you're not surprised. If you add the insurance company column to the employer column to the plan column, if you add those 3 together, they will not equal the total charges.
I noticed
Because the difference are the discounts. This doesn't show the discount, the Blue Cross discounts.
Contract that they pay a percentage of it.
Right. So those 3, if you want to know what your discounts are, you take your total charges and you subtract those 3, and that'll tell you what the discounts have been on those services.
Which is significant. It's a pretty good chunk.
Mm-hmm.
$90,000.
Yeah, and you'll get your biggest discounts on hospitalization. That's where you see the biggest discounts. Any, Any questions on any of that? Anything additional you'd like to see?
I mean, it is what it
Just a
is.
snapshot, yeah. Can't take the claims away.
On these numbers over here again in that total charge, and we'll just go to just the second one, at 11. That could be the same person going 4 different times, or you know what I mean?
Mm-hmm. Yes, it could.
If one person could have 4 of those, for instance.
Yes.
The same way down here, this is really not the number of people, just the number of visits.
That's the number of, that really is a number of,
Yeah.
I think of it as like the number of instances where something was billed for. So, for example, if I went to the doctor 5 times in a week, that would generate 5 charges, because they would bill, they would submit that separately each time I went in.
Right.
Yeah.
Okay,
Does that help you? Okay. So you can build up some claims count, you can build up some pretty big numbers with hospitalization because of the way that billing cycle goes through and all the people that end up being involved in providing that service. So what we really want to hope for is things to level off in terms of the claims activity. But I'll also tell you that in terms of what we should think about for renewal, there's some uncertainty out there that we really don't know how it's going to affect renewals. I will tell you that we have seen, as it relates to Blue Cross, we've seen a significant reduction in renewal adjustments for January 1 versus even the December 1.
Really?
They've come down significantly. And we have a theory about it. We'll have to see how it plays out. But one of the things that's occurring under healthcare reform in 2011 is the health insurance companies are going to be subject to minimum loss ratios. So I'm going to oversimplify it, but basically, for every dollar of premium they bring in, they have to pay out 80 cents in claims. And so if they only pay out 70 cents, then they have to rebate that 10-cent difference. So I think they're being a little more, that's the only thing I can really attribute it to, because claims activity hasn't slowed down. So we're just going to watch that, and maybe this year we'll benefit from that, I don't know.
Just one second. Will you stop and talk to me before you do?
Sure.
Sorry.
Oh. So, maybe we'll benefit from this, because everybody's trying to figure out from the insurance company what's that mean, and they've got to implement it in 2011, and frankly, the first set of interim regulations didn't come out until the end of November. So they've been doing things based on what they think they know. And those regulations, just on that issue alone, were over 300 pages. So,
It's just overwhelming.
it's just, so, but that's just what we've seen. We'll have to see how that plays out, but that may end up being something that, so I think at least that's partially due to the drop in the pool adjustment, for sure. And we'll have to see how that plays out as our renewal starts to come in. But they have come down significantly.
That's good.
Hopefully that stays and that continues to be the case. But we were seeing, it was not uncommon to see renewals in the high 20s, low 30s.
And so now what are you saying?
Now we're seeing, we're more likely to see 5 to 15. Few 20, but not very many, based on that first quarter. So I mean, significant. It kind of went from last summer through the last 6 months of this year. We get, whenever they release the renewals for the next month, you just hated to open them.
Just cringe.
Yeah. I still do, but it's not as bad. I don't hate it as bad, I can tell you that. But, so we are seeing some positive movement, and maybe that'll play out to our advantage, we hope.
Sometimes I get the impression that because you have insurance, especially Blue Cross, when you go to the hospital, then they want to run all kinds of tests that maybe isn't even related to why you're there. And then they start, well, he's got insurance, we'll run this test, we'll run this test. I get that impression, I don't know whether it's true or...
Well, I don't know the answer to that. I can tell you that, because we deal with so many people on claims, it's not uncommon to hear a story where someone says, if they might question cost of something. We see it a lot with medical equipment. There's a cash price and there's an insurance price, and the answer is, well, what do you care? You have insurance. Insurance will pay for it.
Right.
So we do hear a number of those types of stories. Whether or not that's a determination on some of the testing, I don't know. So, okay.
Okay.
Anything else? Any questions on the claims experience that we didn't touch on?
No, I don't think so.
Okay. I put down on the healthcare reform, we can cover those. We'll do what you want. I put down, these are the ones we're getting questions on.
The very first one's the one I wanted to visit with you about.
Okay.
Our representative and we disagreed about where we thought we should fall, because as everything that I've read indicated that it would be from the view or from the spot of the consumer. And yes, we did change our plan, but we did not change our benefits to our employees. And I just totally disagree with the position that they're taking, because that isn't the way it's written, as best I can tell.
Yeah, I would agree with you.
How do you feel about it, or what should we do, or everything that I had seen, it was it all revolved around the fact that you hadn't changed benefits to your employees. It didn't say, did you change your plan to your provider?
Right.
It was, did you change benefits to employees? And we did not. And I just really think that's wrong.
We're in ongoing conversations with them on that. And I'll give you a couple of examples. I know what you're talking about. Blue Cross has taken the position that, and I think it's a position of, again, this is me talking, I think it's a position of administrative convenience in terms of what they track and they don't track. And they have taken you're right, they have taken the position that if you changed your plan design with Blue Cross after March 23rd of 2010, then as far as Blue Cross is concerned, you are not grandfathered. We've had and continue to have ongoing discussions with them about that. You know, in terms of, is that accurate, we don't think it is accurate. But here's the interesting thing. We have another group that we didn't change the plan that we have with Blue Cross. That stayed the same. But through the self-funding part, we did change the plan to the insured. The types of changes that would take them out of grandfather status. And so we communicated that to Wellmark, and they were in agreement with us that that was a non-grandfather plan.
So we can have it both ways.
They have it both ways.
So
Their attorneys.
So that's what we're trying to work through that with them. One of the things that I think was interesting here as well is, because I wanted to get an update from you guys, your bargaining contract cycle. When was?
We have the same plans.
Right, but when is your contract?
We just renegotiated. We're in the first year of 3.
And when did that was effective?
July 1 of this current fiscal year.
Both of them?
Yeah.
Yes. 'Cause they're on the same rotation.
That's what I was thinking.
That's interesting that you... Because that was the argument that we got, that we just... we changed plans with them, so
Right.
we couldn't be grandfathered, and then on the other hand, they didn't change plans, but you changed it to the employees, so you're not grandfathered.
Yeah, because we went back to them and we said, I don't think we can be grandfathered because, and we agree. The reason I say I think it's a matter of administrative convenience for them is why they've made that. I don't think the law says that either. And I think the law says if you make these changes I think it is from the insurer's perspective. This is how you look at it.
When I thought about and thinking and talking about it later, what they're indicating for the extra coverage for the benefits what we're getting for, they're saying 1 to 1.5% differential in the premium. It's worth it.